Today on this episode of The Brain Surgeon's Take, we will be discussing women surgeons, breaking barriers, with plastic surgery fellow and social media influencer, Dr. Daisy Sanchez. Learn how this remarkable physician, born to immigrant parents, has trailblazed her way not only into a surgical subspecialty, but also as a cosmetologist and major social media figure. Despite our country's progress in women's rights, many stereotypes regarding female surgeons still remain. Listen up to hear how Dr. Sanchez overcame these biases and became a role model for all professional women. Much more on this podcast episode. Welcome back, everyone. Here's my take on Dr. Daisy Sanchez. Simply put, she should be a role model for all professional women pursuing excellence. Daisy is a self-made plastic surgeon and major social media personality who is only beginning to scratch the surface of her potential. As a female and minority of Mexican descent, Dr. Sanchez has overcome every stereotype put in her way. She is not only an accomplished physician and surgeon, but also a nationally recognized cosmetologist and influencer on multiple platforms, granting her the ability to educate and inspire the masses. This interview really brought to light how much gender equality work still needs to be done in this country. Despite representing the majority of medical students in the USA, only a small percentage of women enter surgical specialties. Why is that? What is wrong with our system? And how do we encourage more women to become surgeons? #GirlPower. Listen up as we discuss women surgeons breaking barriers. Check it out. Hey, Daisy, how you doing?
Hi, I'm doing well. How are you?
Good. I'm very excited to have you on the podcast to talk about female surgeons and breaking barriers and breaking stereotypes. You've had such an amazing background for multiple reasons, and we'll go through that. And you've been ultra successful. So I'm interested to hear your perspective as an immigrant coming through college, medical school, and becoming a surgeon, what the different barriers you were and you faced and you overcame those. And so look forward to hearing your story.
Well, I'm excited to be here. Thank you for having me.
Tell us a little bit about how you first got interested in surgery.
Yes. So I got interested in surgery. It was actually kind of random, and I say that because I didn't grow up thinking that I was going to go into medicine. I used to say I'd be anything but a doctor when people would ask me what I would wanted to do growing up. And I think it's because I was always on the more creative side, and my interactions with doctors were that, they were always kind of these cold figures that weren't so much creative and friendly and that sort of thing. So I graduated high school. I went to college, again, mostly because I graduated high school as valedictorian. I had really good grades. I went to a very small high school in the middle of nowhere, and I had the opportunity to get a ton of scholarships. And so I didn't know exactly what I was going to be doing, but I was like, all right, well, this is fully paid for, so I should take this opportunity and kind of figure something out. And then when I got there, I took a first year course. I went to the College of Charleston. They had a series of courses that you could choose from, and one of them happened to be kind of an introduction to different fields of medicine. And so I took this course, not really thinking much of it. And then they exposed you to kind of different fields in medicine, and you had to pick someone to shadow. Randomly enough, I think I ended up shadowing a neurosurgeon in Charleston. I just kind of emailed him and was like, hey, can I come in and shadow you? And, nowadays I don't think you could get in that easily, but I just kind of showed up and shadowed and loved it. I thought it was super interesting. I always liked working with my hands. At the time, I was also a cosmetologist. And so I was like, okay, maybe this is something that I could pursue. And so I started looking into it at that time and kind of loved the idea of it. So I decided to be pre-med and then medical school, and then kind of went from there.
If for some reason you couldn't be a doctor, what profession would you pursue?
That's a good question. Honestly, I think I would have been very happy being a cosmetologist. So I worked in a hair salon while I was in undergrad, and then tried to do it a little bit in medical school, and then ended up stopping because obviously the time commitment was too much. But I always really liked working with my hands. I enjoyed hairstyling, cutting, makeup, and that sort of thing. And so I think if that's what I would have ended up doing, I would have been very happy as well.
And who would you say was your biggest role model during this entire process?
I think to this day, my biggest role model in life in general is my dad. So he is not in medicine. He's actually didn't even get a formal education. Both my parents didn't graduate high school. And despite that, he's just one of the most intelligent people I've ever met. And I say that having met very intelligent doctors. I still think my dad is up there when it comes to his intelligence. He just picks up on things. Not only that, he has an amazing work ethic. And he also has just a personality that he's one of those people that just everybody loves. Like the man can start a conversation, a friendship with literally anybody on the street. And I think there's very few people that have that ability. And so he's to this day the person that I admire most.
That's great to hear. I mean, I think having a role model like that when you're not only young but also later in your career to kind of push you ahead. That's wonderful to hear.
It
Um,
is, yes.
as a woman entering a male-dominated field, did you experience sexism? And if so, just give us a few examples.
Yes. So, yes, I think I didn't even know what I was getting into. I think I kind of went into it very naively. You don't, or I didn't notice the sexism as much when I was a medical student. I kind of just felt like, okay, we're all medical students. We all earned the right to be here. It wasn't until I actually started residency. And even through the first year of my residency, I noticed things here and there. But my class was actually an all female class. And so we were all kind of experiencing the same thing. And so we thought, this is probably just normal. Like we're all interns, we're figuring it out. But it wasn't until I think my second or third year when I remember rotating with a first year who was a male. And this was the first time that I'd ever had, a junior resident or another resident with me because my class was the inaugural class in the program. And I remember walking into rooms and automatically every single patient would look at him. They would always direct their questions to him. I mean, I'd come in, I'd explain what we were doing, I'd explain the plan and everything, and somehow they'd still kind of turn to him, or they'd ask, like, is this your assistant, or is this your nurse practitioner, or is this somebody
Wow.
that's working with you? And it was kind of eye opening, and even for I think the junior resident, because I remember him making comments like, wait a minute, does this happen all the time? And I was like, yeah, I guess it does. I just didn't really notice it as much until I was in this situation. And I think a lot of females and female surgeons have experienced this and noticed this, when they come in with a male medical student. And, I think it's something that bothered me more at the beginning because it was a combination of, you know, these biases that people have, but also kind of a little bit of imposter syndrome because I was starting residency and trying to figure stuff out. So the two together were not a great combination. Nowadays, I think it doesn't really bother me much. I'm aware that the biases exist and that there's people that are going to look down on women surgeons and just not have the same respect for us as men, but it's fine. There's nothing I can do about that.
Yeah, I would say that we need to work on that as a society. But
Mhm.
you, as a doctor, how did you ignore that noise and simply keep pursuing your dreams?
Yeah. So I think for me, it largely comes down to my support system. So I mentioned my father, but also my mother and my siblings and my fiance, and I have a 5-year-old daughter, and I just have a huge support system around me that's always been there. And so anytime that I've felt that I couldn't achieve something, I mean, all it takes is a phone call to my dad or my mom or someone, and they will give me a motivational speech that will keep me going for the next 5 years.
I mean, that's what parents are for, right? That's what family is for. So that's also great to hear. Well, why do you think these stereotypes regarding female surgeons exist?
Sorry, you cut off a little bit. What
Oh,
was the beginning?
can you hear me?
Now, yeah, now I
Okay,
can hear you.
perfect. I was going to say, why do you believe that these stereotypes regarding women surgeons exist?
I think it's just because it's been a traditionally male dominated field. And so I think a lot of times when we don't know better, it takes a lot to kind of adjust. I mean, we see that with surgical training. It's been essentially the same for many, many years. And I think in general, the population is sometimes resistant to change. And so I think as we see more women go into the field of surgery and go into medicine and that sort of thing, people will start to realize that, oh, they're capable, they're competent, this is okay, and this is accepted, and it will become more the norm.
And I guess along those lines, how much do you feel motherhood has influenced those stereotypes? Meaning, women should have kids, women should be raising kids, women should be at home, which is obviously not true. How much do those stereotypes play a role into forming these gender biases?
I think they actually play a huge role, but I think it's a very touchy topic, and I say that as a mom, just because everybody, even among women, what women want is different from one female to another. To me, family is super important, spending time with my daughter and that sort of thing. To somebody else, they might not even want to have children. And so I think what everybody wants should be respected, but I think something that is missing when it comes to just motherhood and women surgeons is just more acknowledging the fact that there are physical differences. So men and women can both have children. However, men will never experience, certain aspects of motherhood. They will never experience pregnancy, which is a whole 8, 9 month process. They will never experience, having to give birth and, the whole recovery process after that, whether it's after a surgery, C-section, or whether it's just after delivering naturally. And so I think a lot of times as women, because we know these biases exist and because we're kind of already fighting these stereotypes, it's difficult for us to speak up on these topics and to really say, hey, this is the time that we need physically to recover from this, or we need this time for this. And I think once we accept that those changes exist and just accommodate those things, things will be a lot better for both men and women. I think we're getting there. I think things have changed. Obviously, nowadays it's much easier to get time off when you are having a kid and that sort of thing. But I think we've still got a ways to go with that.
So you did your residency in South Florida, now you're in Texas and you're a fellow. Anything different? Same stereotypes, same biases you're seeing in a different state, different specialty?
I would say, I mean, I think they still exist. I haven't noticed too much of a difference, to be honest, from general surgery to plastics. I think, the call schedules are different, but in terms of the biases, I don't think it's necessarily that much different from what I've noticed.
Let's get into some of the stereotypes which are so prevalent and kind of let's bust them since you've have that firsthand experience. So the first question, which I get asked all the time as a program director from female medical students, college students, is it feasible to become a mother during surgical residency?
I think it is feasible. I think that one thing that, people don't talk about is setting your expectations. So I think you can become a mother in residency. That being said, I actually had my daughter right before I started residency. So it was during my 4th year of medical school. You can do it, but again, it's very individualized to kind of what your expectations are as a mother. I myself actually want to have more children and haven't done so in the past few years because I felt like with my current schedule, I wasn't going to be able to spend the time that I wanted with my newborn and to dedicate the time that I wanted to my pregnancy. That being said, obviously, I have 3 more years of training. So at some point, I'm just going to have to make the decision. I think it is doable. I think it's largely dependent on your program, how supportive they are of you and your situation, and how much they can remember that you are a human being throughout the process. Because there are these kind of rules set in stone. Obviously, this is how much time you can take off and this is what you can do. But anybody who's had a kid or who has gone through pregnancy knows that you can't plan for everything. You can try, but you might have a perfect pregnancy or you might have 20 different complications and 20 different things that arise. Um, and kind of on that topic, I actually gave my grand rounds for the conclusion of my residency on women in medicine. And I found a couple studies that have looked at, I mean, granted, they were based on kind of self reporting. They sent out surveys to women, but they found significant discrepancies in the amount of complications that women were experiencing when they were surgeons, working just like 3 days a week, performing surgeries. And so I think we don't even fully understand the impact that surgical training has on our health, our pregnancies, everything. And so putting yourself in that situation is something that you obviously have to think about. So long-winded answer, I think it is certainly possible, but I think you have to always have a good support system, make sure that your program is supportive, and also make sure that you're prioritizing your health and the health of your child or future child along the process.
So the next stereotype, which I wanna hear your perspective on. I mean, I already know the answer to, but I just want to hear you say it.
Mhm.
Can women handle the physical and emotional stress of being a surgeon? Are they tough enough?
Yes. I think women and men are tough enough. I think this is a difficult question to answer in terms of should women and men handle the stress that's involved with surgical training. I think being a surgeon in itself is obviously going to put you in a lot of situations of high stress, but I think our current training system could also be made better to kind of mitigate those stress levels that already exist. In other words, not adding toxicity to an environment that's already high stress. That being said, I think my program was very supportive as I was going through it, and I think it helped kind of mitigate some of those things. But I think, of course, men and women can handle the stress of being surgeons and becoming surgeons.
So you talked about training and how it's been evolving. H- How do you think surgical training has evolved in the last, let's say, decade to number one, facilitate that stress management that you talked about, but also to combat gender stereotypes?
Yeah. So I think one thing that comes to mind, just it's all I know, but I know that it's been a big change over the years, is just the hour restrictions, which some programs abide by strictly, some programs maybe not so much. But I think that's been a big step in the right direction. In terms of just, recognizing that we're all human beings. And so I think we forget that a little bit in medicine. And those of us who go into medicine always have a little bit of an altruistic nature. And so I think the system sometimes takes advantage of that a little bit, just kind of teaches us that we have to give, give, and give. And sometimes we have to be able to recognize when we ourselves are not doing great, whether that's physical, emotional, mental, whatever it is. And so I think what I've seen in recent years is just my general surgery program, for example, implemented these wellness days. They were kind of 5 wellness days that you could utilize, whenever you thought was appropriate. And although it doesn't seem like much, it made a big difference. And so for things that would come up, life things, or you might have an appointment or something that you might otherwise not be able to make, I think that was a big change. I know that a lot of programs have been implementing kind of wellness activities, so to speak. I would say that wellness modules are probably not the best route, but I know a lot of programs use those. Nevertheless, I think that each little thing that is implemented is a step in the right direction. I don't think that there's one specific answer or that we're going to nail it from one day to another, but I think just acknowledging these things and trying to kind of mitigate the stress and everything is helpful. And overall, long term, I think we'll get there.
And looking at bigger picture, do you feel that these gender stereotypes have narrowed the pipeline for female surgeons to get promoted within academic medicine? So you've been to two academic programs. Do you feel like the academic model also discriminates against females being promoted within academic surgery?
I think based on the data, yes. Just because if you look at the studies, I mean, there's just less women in academics. Granted, it's hard to tell how much of that is just because we're still in that evolving stage. You know, we're getting more women into surgery, and so it's going to take a while to get more women into those academic positions. Um, but I think it's very hard to quantify, you know, the stereotypes that still exist, because no one's going to outright admit to you that, hey, you didn't get this job position or you didn't get this, you know, title just because you're a woman. They're going to tell you other things. You're never really going to be able to pinpoint it. I think a lot of women can kind of pick up on these things as they're going through the process, whether it's applying for a job or a position or title. I think it's also something that's evolving and improving. And from what I've seen in publications, the numbers are going up. So there's higher percentages of women in these academic positions over the years.
Let me ask you a very tough question. Having been in this now for several years, do you believe that there are things that female surgeons do better than male surgeons and vice versa? Do you feel there's parts of that job that male surgeons do better than female surgeons?
You know, that's a good question. If I'm answering this objectively, I have seen some papers recently, obviously, that, you know, women have better outcomes and that sort of thing. They've looked at like short term and a little bit longer term outcomes, and they found some differences. Um, Granted, some people will make the argument in those papers that women are also not doing the more complex cases, perhaps as the male surgeons are doing. So I kind of have read about both sides. Um, I will say, just from my personal and very biased perspective, it's a very subjective point of view. I have noticed that men tend to be just very confident. And so I think that I noticed this a lot in my training, that the male surgeons would just say, this is how it is. And the patient would look at them and be like, all right, okay, that's how it is. They'd accept it. And they just say it with this confidence. And whether they were 100% right or not, they had the confidence to say it. And I found that oftentimes female surgeons kind of struggled with that a little bit. And I obviously I'm a woman, and so I would love to see women be just as confident as men. But I think because of the fact that we battle these stereotypes and battle these things throughout our training, we're kind of used to always having to go the extra step, the extra mile to prove ourselves a little bit more. And so I think sometimes that can affect our confidence a little bit. And so that's one thing that I just personally noticed, that sometimes the women would like hesitate a little bit. And I almost wanted to tell them as a bystander, hey, this is exactly what that male surgeon would do. Like, say it with confidence because you got this. And like, you know, you got this, but you're hesitating a little bit. And so I think we also have to do our part to just be confident in what we're doing. And just because somebody else's perception of us might be X, Y, and Z, we can't let that affect our perception of ourselves. And I think that's something that a lot of women deal with. You know what their perception is, and it's hard to not internalize that and then represent that. You have to just leave it at that. That's their perception. That's none of my business, and it shouldn't affect the way that I handle my work.
That's such an important point that you bring up. I mean, I talk to our residents all the time, you know, male and female, obviously. But as a surgeon or as a doctor in general, you're making life and death decisions, critical decisions that affect people, their family, their friends every single day, dozens of times a day. And you're not going to be right 100% of the time. No one is. But you got to be right most of the time, and you got to go with your decision. You got to live with the decision. And I think that hesitancy is not healthy as a surgeon. You can't, right? Because then you're always going to second guess yourself, and then you're paralyzed by fear. Patients kind of smell that and they go elsewhere. And so that's a
Mhm.
great point you bring up. And I agree. Women go through their training, they go through residency and medical school, and they're second guessing themselves like, I'm the only woman in this room. Like, why should I be here? And then that comes across when you're talking to patients. And you're right, that's a recipe that's not going to work for
Mhm.
overall success. I think making sure women understand, like, yeah, if you know what you're doing, just say it with confidence. That's huge. That's a very, very big point.
Yeah.
Um, you brought up also, you know, women now make up the majority of medical students in this country, which is phenomenal. I think it's like 55% or something of all the medical students, but only a small percentage become surgeons. How do we encourage more women to enter surgical specialties?
Yes. I think I think a lot of it has to do with probably the lifestyle of being a surgeon. And like you said, topics like motherhood and that sort of thing. So I think the more we acknowledge like the physical differences among men and women, the importance of motherhood for those residents who might want that, I think that will encourage more women to go into the field. I think also, a lot of us have heard the stories and we know the stereotypes exist, and it's a field that's been traditionally male dominated. And so whether you like it or not, if you end up going into surgery, there's certain things that you're going to battle that you probably wouldn't have to deal with if you went into a different specialty. And yes, it's great to make changes and to move forward as women in surgery, but it's also a big burden and a big load that we have to deal with when we decide to go into surgery. Would it have been easier for me to go into a different specialty and not have to deal with, proving myself every other day, or maybe not as much? I think yes. And so I think these are a lot of points that people have to consider and women have to consider when they're going into surgical specialties. I think it'll improve over time, but we've still got a ways to go with that.
Definitely have a ways to go. I can tell you that in the last 10, 15, 20 years, it's definitely moved in the right direction.
Mhm.
Back when I started training in the mid 2000s, women did not do neurosurgery, or very few, because it was understood you could not possibly have a kid during residency. It was just, you couldn't do it. And those were
Mhm.
7 years that were like the optimal childbearing years. So women were like, I'm not going to do that. And now women in residency have kids, and they have healthy kids, and they're still operating, and they're still doing their job, and they become, phenomenal surgeons. So I think making sure that we don't perpetuate that stereotype of women surgeons can't have kids, and understand that you can have both. Like you said, it's hard. It's very hard. You've got two major commitments, but it's doable with the right person, the right discipline, and the right focus.
Mhm.
Wrapping up here, because I know you're super busy, but
Mhm.
uh, what advice would you give any of our listeners who want to become the next Daisy Sanchez? Women who look and say, wow, she's so successful in so many things. She's battled so many stereotypes. She's made it. She's confident. Uh, I want to be like Dr. Sanchez.
Yeah.
What would
So
you tell them?
I would tell them don't do that. Just because what I mean by that is don't try to become the next anyone. You should try to be yourself and stay true to who you are throughout whatever journey you're taking, whether that's surgery or a different specialty or just being in medicine altogether. I think that's one of the things that I struggled with the most just throughout the process and being a woman in surgery, but also just trying to maintain who I am. One of the things that stood out to me when I was wanting to go into surgery was that I didn't feel like there were people like me. And what I mean by that is just even with, I don't know, the makeup and these things. And like, I just felt like when you went into surgery, you were asked to tone yourself down for, the benefit of the others around you. And so when I started surgical residency, it sounds like something so trivial, but people would make comments on my sweaters or like my watch or my makeup and things like that. And at the beginning, I was really bothered by it because I was like, why are these people paying attention to these things? Like I'm doing a good job as a resident. And as I went through my training, I just kind of tuned it out. I realized, like, this is who I am. The things that matter to me, it shouldn't matter to anybody else. Like, yes, they're going to have certain perceptions, but again, going back to I shouldn't perceive myself that way. So just because they perceive me a certain way, I shouldn't accept that. And so I think once I realized that and started acting that way, people around me also noticed it and they started realizing, oh, wait a minute, she's actually good and she can do surgery and she can do these things. And it doesn't really matter. Like all these other little things are trivial, they don't really matter. Like she can be herself and she can continue in this career path, even with social media. Like that was another thing that I think it's becoming more accepted. But when I was early in my training and started growing a platform, it was kind of, what are you doing? This isn't really a good idea. And again, I stuck with that because I believed in it. So I think what I would encourage everybody to do is believe in yourself and be who you truly are throughout the process, obviously while maintaining professionalism, while doing all the things that you need to do at work, but just kind of don't lose that sense of self because you want to be like somebody else or because you feel like you have to fit a mold in order to be accepted in a certain profession. I think that that's the key to really being happy in any profession is being able to maintain that sense of self and the things that you truly believe in, the things that you truly want, while also being able to be a professional.
I think that's really well said. I tell our trainees, both when they're training and when they graduate, with success, you're going to have professional jealousy that comes around from different angles, people that maybe don't understand, don't want you to be successful. And so I think your take home point is phenomenal for any woman pursuing medicine. Like, you're going to be looked at differently and you shouldn't care. You just literally shouldn't care. And if it's what you love, do it. Don't look back and just keep going. And at the end of the day, all those haters, those all those voices are going to fall away. Um, where do you see yourself in 5, 10 years? You got 3 more years of training. Um, do you see yourself in academics? Do you see yourself private practice? Do you see yourself teaching?
I don't know. I think I see myself hopefully having more kids because that's something that's important to me. I obviously have a 5 year old and I'm hoping to have at least a couple more kids. I do want to be somewhat closer to family, so maybe I'll end up back in Florida. In terms of kind of the professional side of things, I really like reconstructive surgery a lot, so I think that I'll definitely want to, even if I end up in private practice, want to be affiliated with a hospital and be able to do kind of these bigger reconstructive surgeries. And I don't know. I think that's the plan that I have for now. I definitely would like to teach. I think it's something that I enjoy. I've enjoyed having medical students, and it kind of keeps you motivated in a way. Like I get a lot of messages from medical students. They're like, "Oh, you motivated me to want to go into surgery," but I'm like, "You motivate me," because it's nice to see that eagerness and that you know it's almost like a super eager naiveness, like they're just so excited to be there and so excited to learn all the things. And so I think that also keeps us motivated, and it also pushes you to stay up to date, because if you have to teach somebody else, then you have to stay up to date with medicine, which is always constantly evolving and constantly changing. So you have to really keep up with your reading, make sure that you're doing the newest and the best for your patients so that you can also teach that to the medical students.
Yeah, I would say, just being in academia, I think it's the most intellectually stimulating job on the planet. Every single day is new. The cases are cutting edge. The residents, the fellows, the medical students. There's really nothing like that variety on a day to day basis.
Mhm.
Wrapping up a phenomenal interview, Daisy. I think, yeah, first and foremost, congrats on everything that you've accomplished. You're so multifaceted, so talented in so many different areas. Congrats on that. And then I think kudos to being such a role model. I think we need more women like you that are trailblazing, that are setting the standard. And, maybe you don't want people to kind of follow Daisy Sanchez's footsteps, but they are. Definitely women are going to look and say, I can do that. She can do it. I can do it. And that's exactly what we need. We need more women in neurosurgery, surgery in general, medicine in general. So again, thank you for being such a great role model for all the young women in this country.
Thank you. I appreciate that.
And good luck with the rest of your fellowship. And we'll talk soon.
Thank you. Thank you for having me.
Take care. Have a great day.
You too. Bye bye.